Hello, I'm Dr. Marla Shapiro. I'm a past president of the Menopause Society, joined by another past president of the Menopause Society, Dr. Pauline Maki. Dr. Maki is professor of psychiatry, psychology, and obstetrics and gynecology, director of women's mental health research, the associate director of the Center for Research on Women and Gender. Who better to talk to us on an area that so many women are confused about, which is menopause, cognition and brain health, dementia, the use of hormones. Teasing this all out for women is so difficult. So many women that we see, and I will take the point of view of that woman, reaches midlife, perimenopause, menopause, and begins to notice changes in memory, never mind mood, word retrieval, I'm in a room, why did I come here? And begins to get very concerned that these symptoms are a harbinger of dementia or something worse. So what to tell women like me who are wondering?
Thank you, Dr. Shapiro. You're absolutely correct. It's very challenging for women to understand these symptoms because when they look online, there's so many mixed messages from there's no effect to these are the signs of Alzheimer's disease and your brain is changing. So what I'd like to do is to share the information that we have based on the best science, right? So what is the best science? The best science to understand if these are real are studies where we follow the same woman as she transitions through the menopause and we test her cognitive abilities and we ask, are they changing? Independent of the fact that she's getting older, right?
Right.
And those studies show, in fact, they are. And it appears that one ability, one aspect of our thinking changes more so than others. And that is our ability to learn and remember new verbal information. So stories, conversations, web videos, all of this, right? And it affects our ability to function in our daily life. So those changes are real. What's driving them is the question. And it turns out that there's a fluctuation in estrogen led by or followed by a decline in estrogen that does seem to be involved. But let's think about this. Every woman who goes through menopause experiences this drop in estrogen. But not all women experience brain fog or memory problems.
Just like not all women get hot flashes.
That's right. That's right. So is it a one-to-one relationship between brain fog and changes in estrogen, or is there something else? And we think there's something else, and that's menopause symptoms.
So then when we look at women who have horrible hot flashes and night sweats, because some women start early, well before they lose their cycles. We know these women, we are these women. Some women transition with no symptoms whatsoever. They just sail into menopause and there they stay.
The lucky ones, yes.
The lucky ones, yes. Does that correlate in terms of the ones who complain more than anybody else?
Yes. So there are 3 symptoms that are really linked to cognitive complaints. One is the hot flashes. The fancy word for that is vasomotor symptoms, so hot flashes. And these are the ones that we experience during daytime hours and when we're hoping we're sleeping instead of having a hot flash, so night sweats. So that's one of the symptoms that's linked to cognition. The other one that's linked to cognition is mood. So the lower our mood, the worse our cognition. And the third one is sleep. So if we sleep poorly, our mood can suffer, right? So those 3 symptoms are all associated both with subjective, meaning I think my memory functioning isn't good, as well as objective functioning, which is my performance on a memory test. But the really, really important thing for women to know is that your perception that your cognitive abilities are changing is validated in research studies. So in other words, when we ask women, do you think your memory is changing? What we find is, in fact, that her memory is changing. So the tests validate her complaints. So women, it's not all in your head. It's real,
Absolutely.
and it's a menopause thing. It's not a dementia thing.
Okay, so the World Health Organization recently came out with 14 different areas that can help reduce and prevent dementia. And many women want to do everything to prevent dementia. So we often think about heart health and brain health going together, exercise, diabetes, cholesterol, not smoking, alcohol,
Yes.
all of those things that one would normally think of for your heart are good for your brain. Are there
Yes.
any other preventive strategies that women can adopt in this area?
So one interesting thing is we want to bring the healthiest brain we can into midlife, so that when our brains go through this transition, we're more resilient to them. So what does that mean? It means it's never too late to think about your brain health. How do we build a healthier, more resilient brain, and how do we continue to build that? There's a lot of ways. One way that women don't often think of is social engagement. So it turns out the more we're engaged with friends, with family, in activities with people who share the same interests, the better our brain health and actually the better our heart health. So social engagement is so important. When do we not socially engage? When our moods are low, right? And so it turns out that actually low mood is something we want to treat to protect our brain. So if we have clinical depression, meaning our moods are so low that for 2 weeks, we're just not functioning well. We can't carry out our daily activities. We want to address that with a provider. If, like me, you have sad days and you have days where you're not, very interested in things, you also want to treat those subclinical depressive symptoms. You want to get out there, you want to engage with friends, you want to get on that exercise bike, you want to go for that walk, right? You want to do things that get you, if you will, out of your head. So keeping our mood high is really important. Eating the Mediterranean diet is, interestingly, an evidence-based approach. So I get asked a lot about diet and cognition. The Mediterranean diet is the most well-supported. Don't give yourself another to-do to be perfect. That's not the goal of this conversation. So how do we adopt the Mediterranean diet? Instead of grabbing those chips on Tuesday night, grab some hummus and carrots instead. Eat more of the Mediterranean diet, right? And then in terms of exercise, we want to get our heart rate up. We want to manage our stress. And then there are things we don't want to do. We don't want to manage our stress with alcohol. We don't want to have more than 1.5 glasses of wine per night, because it turns out that that isn't particularly good for our cognitive function. Although being stressed isn't good for our cognitive function, we want to limit our alcohol use. If we haven't been able to kick the smoking habit, we want to kick that smoking habit, because that's closely coupled with the risk for Alzheimer's disease. And sadly, too, we want to avoid any risk-taking activities that might lead to damage in our brains. So ski accidents and things like that, although they're low probability. I mean, once a person gets a traumatic brain injury, they're at dramatically increased risk for Alzheimer's disease. So you want to just think broadly about how you're going to manage your brain health.
And the importance of challenging your brain, using your brain, using skills to promote plasticity. So before I let you go, we've seen, this pendulum back and forth more times than you and I want to, I think, admit. But as a woman, if I'm having intractable hot flashes and night sweats, and my healthcare practitioner says menopausal hormone therapy, you fit in the profile, low risk, the window of opportunity, I go home and there's this big black box that tells me if I take this, I'm actually going to get dementia. How do women in general reconcile the message that they're getting, even in their healthcare practitioner's office? How do we preempt that discussion to be able to say, hey, that black box warning, that may not be for me?
Right. It's a critically important question. So we get this warning not to take it because it's going to damage our brains by increasing our risk for dementia. And I might add that on the other side of things, you get messages on the internet through certain channels that you should take it for primary prevention of Alzheimer's disease, meaning you should take it because if you're on it, it will prevent Alzheimer's disease. So let's just very briefly talk about what we know. And I'm going to tell you how we know because it's important for women. The best way to make decisions about what we put in our bodies is to rely on scientific studies that take a group of women, give half of the women that thing, say hormone therapy, and give the other half a placebo. And then you compare those women, right? The good news about this topic is we have very good data on cognition. So what do we know about cognition, our ability to learn and remember in hormone therapy? Well, if we're postmenopausal, there are 4 of those studies, very, very good studies. Women should feel good about having high quality evidence here. All of them show neutral effects. No risks, no benefits. So for the woman,
neutral's good.
We'll take that, no harm.
Right.
That's good,
Absolutely.
right? So it's not causing the dementia. That was, in fact, I think, real and triggered by a very, very specific type of hormone therapy, conjugated equine estrogen plus hydroxyprogesterone acetate, a formulation that women aren't prescribed very often at all anymore.
Right.
So it's not really that now. The evidence doesn't suggest we need to worry about that, but nor, equally important, does the evidence say, oh, if I take hormone therapy, it's going to improve my memory. There are 4 studies that tested that very hypothesis and found no benefit. Okay. Now, what do we not know? And what should we as women, say we need to know? Let's get more research about this topic is, will hormone therapy benefit my brain if I have hot flashes? And the answer seems to be, based on studies of non-hormonal treatments for hot flashes, that it may very well treat your brain, that there's something about having these hot flashes that's bad for our brains. So if our goal is treating our menopause symptoms, then we may, in fact, get some cognitive benefit from these. And so that's an area of work of active interest, active research right now. And we want to be able to give women more direct answers to that question. But that is a setting in which theoretically women may very well gain some benefit.
Such important information, evolving information, and I think reassuring information that as a woman, if you're having hot flashes and night sweats where therapy has been indicated, the neutrality of the impact on your brain, reassuring, and the improvement on your brain by decreasing hot flashes, also reassuring. So stay tuned. Dr. Maki will be back every year as the data evolves. Thank you so much for being with us today.